Good afternoon, everyone. Very happy to have you with us in this afternoon. We thank you first for joining us to this event. We're very happy to be partner, quickly to say that we are partnering and very proud to be partner of the French Pavilion during this Expo 2020. This is our second event, and we will be discussing and talking about indoor air quality. I'll give you a very brief presentation on the group, IGIENAIR, who we are, and later on I'll leave the floor to my colleagues to talk on IGIENAIR services and the innovation department, ZAC department. Very quickly, IGIENAIR in numbers, so in 2020, 62 million euros. The company was founded in 2003 in France. Initially, the main job of IGIENAIR was services related to indoor air quality. Today, we are more than 600 people in the company across 30 branches all over Europe and a branch in Dubai that covers UAE and the GCC countries. We have more than 4,800 hours on accredited training in-house for our technicians and engineers, mainly in a center in France, and 25,000, this is to give you an idea of the number of clients that trust IGIENAIR across the world, more than 25,000 clients. Another important number that we are proud and happy to insist on this point, which is IGIENAIR invests 3% every year in innovation, mainly in the department of ZAC. And later on, Madame Yasmin will be giving you a presentation on the department. So this is quickly in France, more than 30 branches that cover all France. So we are very close to our client all over France, mainly the big cities, but also small areas where our technicians can reach our clients. 14 agencies across Europe and also in the UAE. We are happy to say that we are implemented in Germany. We have 4 branches in Germany. We are also in Switzerland, in Luxembourg, in Belgium, and in the Netherlands. And as I said, in 2015, we settled our branch in UAE to cover the region with a big focus to the UAE market. Our services and how the business is organized within IGIENAIR Group. We have a pole of activity which is under air quality services that ensure control and management of the indoor air quality. We have also a department on global services that ensure safety and health and safety for the working areas, and home services that covers all the other sectors that maintain ventilation in the residential area. So the business sectors are divided into 6 sectors. As I said, IGIENAIR covers all indoor air quality across all sectors. Healthcare industry, pharmaceutical, public buildings, industrial, hotel, restaurants, and residential. So we really cover the whole type of industries, from healthcare, pharmaceutical areas, which are very critical, to residential, hotel and restaurant that has need another type of application and type of approach. I will give you an idea about the type of services. So audit, control, consultancy. This gives you an idea. Within IGIENAIR, we have teams, technicians, and engineers that are specialized to go on the site, do the investigation, give a consultancy to the client, and suggest the accurate solution. We work also in the clean room industry. Clean room, it's in the hospitals, in the pharmaceutical area, and the semiconductor areas, some military application. The clean room industry has a different approach, and also you have to be trained to work in a clean room industry. We also have all the services within IGIENAIR to cover this main industry. Air duct cleaning. As I said initially, IGIENAIR is a service company, specialized in duct cleaning is the main job of IGIENAIR initially. So ventilation system across all the buildings need to be maintained, and duct cleaning is one of the major actions that has to be performed by the end user every year, and depends on each building. There is a different regulation that Mr. Ryan will be talking about later on. Some other departments, monitoring and treatment of indoor air quality, Madame Yasmin will explain more into details later on. Sealing duct, this is also solutions to improve the indoor air quality in the buildings. We have solutions to seal the ducts and seal the gap in the ducts in order to improve the indoor air quality. Now, let's talk indoor air quality in details. I'll leave the floor to Ryan Zahour. He's the technical manager in the UAE, and for the region, he'll give you more details on indoor air quality. Please, Ryan.
Good afternoon, everyone. First, allow me to thank you for coming and joining us on this presentation and day. I'm Ryan Zahour. I'm a mechanical engineer, and I'm the operations and technical manager of IGIENAIR Middle East. The topic that we will be talking about today is indoor air quality. So before I start, I would like to ask you how many of you believe that they really live in a very healthy indoor environment, are very satisfied about the air quality, and I can see many heads shaking like. So yeah, mainly this is a topic that is kind of not very comprehensible for everyone, but still everyone knows and feels that there is something happening. So what we are trying to do today is we'll go through the pollutants, talk a little bit about the pollutants, and then we will talk about different situations where we encounter indoor air quality analysis or aspects of the situation. And then we will talk about the health risks of those in different places, because it's not the same in a hospital or in a restaurant, for example. And then we will talk about the regulations and then solutions and how IGIENAIR can help you to resolve your problems if you have any. So the first slide will be just listing some of the indoor air pollutants, which I'm sure many of you know a lot of them. It could be as simple as bad odors that could happen just for a few minutes in a place for whatever reason, and then it's gone. And it could be a problem of CO2 generation in a building that is maybe related to bad ventilation. And that will cause different types of problems. Some of them are easy to detect, but some others are not easy to detect. So I would like just to read them, like the hydrogen sulfide, formaldehyde, cooking fumes. Although we don't really relate cooking fumes to indoor air quality, but that is one major thing that we have in our houses. Propane could be an issue in a house if you have a leak. That is a big indoor air. Like when we say air, we mean what we breathe. So it doesn't really mean pure air. Viruses is something that we all now are aware of and we are kind of scared of, but that has been there since ever. Bacteria. Lab fumes, if you are not in a residential place and if you are in a lab setup, then the fumes are really risky, because if someone is doing any specific application, then we have another problem. So we are generating some fumes that could be risky for example, in a hospital. That could be a really deadly situation. Anesthetic gases, which are good in principle because doctors need them to work, but those are really risky in a hospital setting. Dust, CO2s, and sand are also the particulate, are all the dust that we suffer from, especially here in this area of the world. We have, by nature, there is sand outside, and this sand and particles can reach into our houses. So if you want to categorize the pollutants in indoor air quality, then there could be two major categories. One is the viable, and one is the non-viable. Of course, we all know what is the viable: allergens, viruses, mold, fungus, and everything else. And the non-viable are mainly the chemical or the physical things that can be natural and can be not natural. Like, for example, when we say CO2, it is natural. However, it could be, depending on the concentration, it could not be so welcome to have CO2 inside any environment. So basically, these are two major categories to be taken into consideration. So whenever we go and test indoor air quality, we have to look at both types. And these have different testing protocols and equipment. Now, the next point is, after we know what are the categories of the indoor air pollutants, we have to know also which application we are in. We are most of the time talking about indoor air quality when we talk about household or offices, because most of us spend time in the offices. So it's good to know that indoor air quality in a household could be really very polluted. If you go back to the cooking fumes, it could really get very dirty. However, on average, it could reach 5 times the concentrations, 5 times more than what you have in the outdoors. And the types are also all types of particles, like the airborne particles or formaldehydes, which is the really annoying smell that you can get when you have new furniture. Household gases, which is detergent and everything else. Ozone, which could be generated due mostly to the electronic equipment that you have, and carbon dioxide, which we generate naturally. So that is in the household, but this is not the only thing. The other place, it could be in the workplace or in the office or anywhere else. So in this situation, it could get really tricky, because if, for example, in the first slide, as you can see, if you have somebody working in a welding factory and that is the situation, they really have a big issue about indoor air quality. And that is not just they will not only have a little headache, they will really have a big problem. Picture number 2 is in a pharmaceutical lab, for example. So if you have a problem in air quality, then you will have a product that will be contaminated, and then the problems become really very big. And this third picture is really about comfort. So yes, it could be only a matter of comfort. It doesn't really have to be very big. So I'm just trying to say this to say that the spectrum is really very big, and there are so many things to be taken into consideration. Now, in numbers, it's good to know that air quality is leading to 8 million deaths per year. So 8 million are not all indoors. 4.2 of them are really related to indoor air quality. So we have 4 million people dying every year because of air quality. And this is the health side of it. In hospitals, we have the hospital-acquired infections, which are the transmissions, like someone goes to a hospital for one reason and then he ends up with another infection. We call them HAIs. So only in the USA, this will cost $7 billion. And 1% of these infections are related to air quality transmissions, to air transmissions. Another point in pharma, for example, and this is not related to human health directly, but we know about a case where J&J, Johnson & Johnson, had a cost of $1.6 billion to mitigate one case of cross-contamination. So they were doing a product and it got contaminated. So to resolve the whole matter, including recalls, including mitigation and investigation, everything else, it cost them $1.6 billion. And also in the manufacturing, like if you are manufacturing a semiconductor, or a hard disk, for example, or a microchip, the air has to be really very clean. And this is not at all related to human health, but this is also a very big concern in terms of indoor air quality. Now we're going to talk a little bit about the risks. So the risks could be immediate and could be considered as a safety risk. Like, for example, if you have, in our built environment, we all have fire protection systems. One of them is CO2 fire extinguishing. And we all know these fire extinguishers, the black fire extinguishers. So these have to be treated really with care, because if you have a saturation of CO2, then the fire will become a problem of safety. People will suffocate because they don't have oxygen. So it could be a really safety risk, and that is one of the signs that are used by the HSE people to say that you have to take care of the carbon dioxide concentrations. Another level would be just discomfort, and it could be due to bad smells or CO2, or it could be normal flu. And it also could be a long-term effect, like if you live in a really kind of good, if you have acceptable air quality, but on the long term, it's not very good, then on the long term, you will start having problems. And most of the impact on the human health is mainly in these areas, and I'm pretty sure many of you or your families can relate to at least one of these, like allergy or asthma or cardiovascular. I'm sure that each one of us knows someone who has one of those problems. So this is just to raise the awareness that it is not just by chance that, for example, I have allergy. So if you go back to the pollutants, one of them was particles. And this is a classification as per the WHO and all the big regulators. PM10 is kind of the coarse particles that we see almost everywhere. And as we go down, those particles we don't see. However, they exist and they will go into our bloodstream. We don't see them because PM10 is 1/10 of the human hair. And PM1 is 10 times smaller. So it's actually 100 times smaller. So this is a risk that we don't really see and realize every time, but it is there and it will affect us. And viruses, we all know now that viruses travel on particles, and if those particles are getting into our body, then the viruses and bacteria are also going into our body. To highlight the importance of those risks, I just put this slide about the WHO, which is the highest authority in terms of health. And they have regulations about each of the pollutants. This is just an extract showing some of them because we cannot put everything in this slide. I would like to highlight on this slide that you have two lines for each pollutant. And you have this to say that if you are exposed to that pollutant for a certain period of time, you have a certain limit. But if you have a longer period of time, then you have a much lower limit. For instance, CO2, there is CO2 here, but it's not as high and as dangerous as if it was a fire extinguished room. And this is a slide where I put all the regulators. So as you said, there are so many regulations, so many applications, so many situations. OSHA is really related to immediate risk and immediate dangers. WHO is more about health and short term, if you would like to say. GMP is a different standard related only to pharmaceutical manufacturers. ISO is, we all know ISO, it's kind of everywhere and related to everything else. So those are international organizations, and there is also local, like Baladi Dubai, for example, they have their own regulations. USP is very specific to pharmacies in a hospital. I'm saying this to say that the story is so complicated that we cannot really address it with only one standard or only one regulation. So you really need someone who can know where to apply and which regulation to take and how to move forward towards a solution. And this is where, so before we go to the solutions, as I said, it depends on the quality of living. So sometimes we are satisfied with an acceptable air quality, but sometimes we want to go even into higher level. This is what is happening most of the time. For example, in Dubai, they really are looking to better indoor air quality. So they go to WELL certification or Al-Safat or LEED or BREEAM. These are higher or much better quality than what we used to live in for a long time. So here I'm going to start now to tell you how we can help you as IGIENAIR. So what to do? We have to go and assess the situation. We need to go, in order to take any action, we have to check the concentrations and the exposure time, as I mentioned before. So when we go there, we have to do an analysis, and we have to take into consideration many parameters. Some of them are listed here, like the type and industry, just to know if this is a house or a hospital, for example. Exposure time, source, like if we know the source, then we have a solution. If we don't know the source, then we have a different solution. We have to check how much fresh air we have, how much clean air we have, what is the humidity, because that will affect also the how much viruses and bacteria we have. So it's a very complicated mix that needs really experts to be able to give you a solution. So if you have any request for analysis and we go to analyze a situation or to inspect a site, this is what we do. We do an IAQ investigation. We go, first of all, define the problem. What are the problems? Where are we going? What do we need? What the client needs? What is, for how long and since how long he has had this problem? So we do a full assessment of the situation. And based on that, we propose a solution. And the solution is, of course, industry specific. For example, here I just put some extracts from different standards. The first one is ISO 14644, which is related to clean rooms. And it has a different classification of rooms and levels of cleanliness. Example number 2, NFS is the French norm, the Norme Française de Santé. GMP is for pharmaceutical industry. ASHRAE, we all know ASHRAE for the built environment. And JCI is not actually a standard, but it's an accreditation body that requires classification as per the others. So I'm saying this just to say that we have so much expertise in all of these fields, and we can really guide our clients to the right destination and standard. So after we did the investigation and assessment, and after we did the testing based on these requirements, we are kind of ready for a solution. And then there is still the long-term solution, which is in monitoring. And at this stage, I will leave the floor to Yasmin. She will tell us more about the monitoring solutions of IGIENAIR.
Thank you. So I'm Yasmin Skanji, head of the Department Research and Innovation ZACK of the group IGIENAIR, and I'm really proud to present you our solutions. In 2017, IGIENAIR has decided to develop this department to invest in research and development, to be able to develop our own solutions, connected solution for monitoring, continuous measurement of indoor air quality, to be able to go back to the source of the problem more easily and having a complementary service to our air quality services that we are providing to our customers. So our team is totally compounded of PhD scientists and developers, engineers, chemical engineers, most of them. We are developing our own calibration system and protocol in 2 clean rooms classified ISO 7. And our solutions till then were already awarded, and the last one that we get, and we are proud of, was the best accuracy of the challenge Air Lab in France. It's an international challenge comparing some microstations, and we had the best accuracy for the CO2 measurement in 2021. This is the first solution we have commercialized. It's the ZACK QAE, or AIQ in English, for indoor air quality monitoring. We are able to measure up to 11 pollutants at the same time with 1 measurement every 30 seconds to provide you a real-time display of the indoor air quality. It's totally connected through Ethernet Wi-Fi or a 4G option. All the data are directly sent to the clouds to be able to be displayed on our application, totally developed in intern. Sorry, just move forward. It's a complete digital platform that we offer you. You will be able to get to the AIQ outdoor index on the display, to be able to compare your indoor air quality to the outdoor one in an easily way. And then we will be able, through this application, to provide you real-time data display, alerts, prediction, and some recommendation after some period of measurement at your buildings. We are able also to personalize the mixture of the pollutants that you are able to you want to measure. We are able to adapt our solution for industrials or tertiary or medical application, for example. And we are also able to connect the data directly to your BMS to be able to pilot the entire system, taking care of the indoor air quality data. Our smart applications are consultable through your app mobile or web applications too. You will be able to consult all your historic of the data and also get all the reports, export your data, get all the statistics, and you're totally, you have the entire management of it. Just to show you very quickly some applications, some use cases of our installation, most of them in Europe and sometimes some of them in the international. So here for tertiary or open space buildings, for example, or here nurseries and schools. Also directly in the BMS systems, like here at the Fondation Louis Vuitton, or in some malls and some galleries also, public systems. Here, our recent collaboration with Balenciaga on their leather manufacturing in Italy. Also some concert, theaters, cinemas, all the public areas, they need to monitor their indoor air quality, particularly in this COVID context. We are also able to do it, to adapt it for outdoor using. For example, here on our big project, the Grand Paris project, building the Olympic Games for Paris with the new subways stations. Also, we are present here in the Middle East with the region and in the Environment Ministry in the Kuwait down. And in production suppliers for industries, for example, here. And just after that, I will present you our recent solution adapted for clean rooms using and controlled environments, which name is Zac CR. And last month, we were very proud. This is an adapted solutions to be able to monitor very small, fine particles for clean rooms adaptations. We are able to control 0.3, 0.5, 1, 2.5, and 5 microns particles for the conformity of the ISO 14644 that Ryan presented you earlier. It provides you data to control your ventilation, and it makes you get ready for qualification and certification of your clean rooms with the real-time monitoring and an easy display of the data. Comparing. It's a complementary solution that we are providing, actually. And last month, we were working very hard, and we are very proud of it. We got the certification ISO 21501-4 for the determination of particle size instruments. It concerns the part 4, light scattering airborne particle counter for clean spaces. And it was very hard. We are providing the first affordable cost solutions to complete the entire procedure for that. So we are very proud to provide you this a kind of low cost, but not in the bad way of the low cost, what we notice in France. And some use cases with our clients, we are working in a partnership with Aptar Pharma. It's an pharmaceutical industry in Normandy. And we started working on this project with them. And they are super happy about this collaboration. The objective was to get this equipment in all their clean rooms classified ISO 7. We have also lots of demands of this kind of product recently, particularly during the COVID period in lots of dental clinic and also ORL cabinets, doctors' cabinets, as they are with their activity, they're using aerosols, so they needed to monitor very fine particles to avoid COVID contaminations and other diseases through air aerosols. We are actually developing also a lighter solution of the first product that I've presented you. It's the Zac QLE Light, and it will be commercialized this summer, I hope. It will be like just a lighter version that makes you able to measure in real time CO2, PM1, PM2.5, PM10, and VOCs. With an easier display, with probably a screen option if needed, and we try to build this solution more affordable for our customers and also more adaptable. So they will have many choices about the connectivity, the alimentation, if they want to have a screen display on the product or not, depending. So we are still working on this personalization product. And we have also another solutions that we are proud to present is our Zac Dust that we are plugging on the open doors on duct systems to pilot the HVAC. It makes you measuring, it helps you measuring the dust thickness in your duct to have some predictive maintenance on the cleaning, the operations of cleaning ducts, actually. We've built this, how it works. It's directly, as shown in the picture, fixed on the access doors. It's connected through a LoRaWAN network. It's not that complicated. It's well known actually in Europe. It's a kind of 2G network actually, and we need a gateway for that to convert internet or 4G signal to LoRaWAN. It communicates with many devices, and you get all the displays directly on an application too. Just to notice about the last solution that I've presented you, the Zac Dust, it responds to a standard that we have in Europe actually. I don't present it like in details this time, but we have some thresholds to respect depending on the kind of the supply we are in, and the kind of duct we are in, and we need to get some alerts and have some corrective and cleanliness maintenance on them. So what is the objective of Zac Solutions? It's a full package of services where we are educating and helping our customers. We're not providing only connected solutions, we are providing a full package of services with an expertise, with advices, with full diagnostic if needed, and with an continuous improvement of our softwares, also our calibration to offers you the best accuracy of our microsensors. I would be very pleased to answer all of your questions. Also, if we have some questions on live, please feel free. Thank you.
Excuse me, just regarding the package you're talking about.
Sure.
Thank you very much. Engineer Isa from Dubai Municipality. Just regarding the package you just talked about it, do you mean if I need to build this system, does mean I have to get all these instruments together? Like mean for dust, for others, for thickness of the dust as well in the what's called conducting system? All this as a one unit, as a one package, I mean?
No.
Or we can choose what we need.
You can choose what you need, and we can build a project step by step. This is our advice. We have developed this full package of products, just considering that For the indoor air quality, we need to measure it actually where the occupancy of humans are in the building, but also a good air quality starts also with the air quality in the ducts actually. So in lots of cases, and it's more common in Europe than here, I think, we have to clean them very often. We have a very specific procedure for that, and you can have like lots of contamination in the ducts. You can have like molds, you can have bacteria, and it provides you the fresh air that you are breathing in your buildings. So that's why it's totally complementary. You don't need both. It's better if you have the combination. If don't, we can move forward step by step. No problem for that.
Thank you very much.
You're welcome.
Hello.
Hi.
You mentioned a lot of examples about hospitals, offices. Can you give us some examples about residential projects that you have had in the past or still have for residential? And my other question is about humidity control. How do you control the humidity in maybe Europe and here, or here in Middle East, July, August, is a lot of humidity, and even though we have air conditioned to full capacity, still indoors, you can see the humidity, fungus, bacteria. How do you control that?
Sure. This is how our package of full services would help actually, because we were doing a full diagnostic when we are taking care of a use case. And the monitoring, the continuous monitoring will help us a lot to get back to the source of the problem. If something happens with a periodic, we are like not measuring only data, we are measuring periodicity. And with this periodicity, we can go back exactly at 30 seconds, at 30 second precise to the events, and do the correlation between the real facts and the metadata that we are measuring. And we are also doing some correlation between the whole pollutants, not only humidity, watching also if there is an impact on temperature, some gases, PM or whatever. We do all the correlation between all the parameters that we are measuring to do a whole diagnostic. And then we are able to do, with the expertise of IGIENAIR services, complementary measurement if needed, if there is a problem to solve.
Yes, hi. We did recently actually an investigation in one place where we installed our equipment for monitoring, and it gave us for a couple of weeks the data. We were measuring the concentration of particles, the humidity, CO2, and based on that, we were able to give the client a solution. So our technology or our solution will help you to assess. For example, the humidity in this region in July, August is very high, okay, and it's a problem. This is a bigger problem. You need to work on the rebalancing of the complete system. However, the solution of implementing a monitoring system will give you also visibility on the high concentration of humidity even during the normal season. And whenever you are above 60% for a longer period, you are sure that developing molds are in your house. Even out of this period of July, August, September, even in February, March, I live personally close to the sea, and I can notice that the humidity is very, very high because we're very close to the sea also. That helps to have a higher humidity. So by implementing monitoring solution, you are able to take the right decision and to monitor and to check in what environment you are progressing, and based on that you can take the right action. IGIENAIR is able to go and investigate based on the type of building. We can question the end user to find the source and give you the right solution. I don't know if I answered your question.
To complete also, I will be able to share, I'm still working on it, on the big study that we have provided with our Zac connected solutions and complementary solutions as purifiers and also IGIENAIR services. that will be published in April, inshallah. It was concerning hospitals, haircuts, salons, schools, nurseries, and also offices. So we are comparing, we had built a protocol, specific protocol to study all the parameters that we were checking. And it was a long-term, it was like a one-year study. So I will be pleased to share these results with you.
I'm waiting for them.
Of course, with all of you.
Thank you. I have a question.
Yes. Just a question here first and then you. Please, sir. Okay.
Hello everyone, it's Imran from HVAC and Power Solutions. So just to continue what the lady asked from you, the first thing, I cannot see there is any RH sensor in your product. So you said you can monitor humidity. You need to have an RH sensor first.
We have.
Yeah,
We have
you have not
actually
mentioned that.
Of course, it's totally obvious for the measurement and plus for our expertise also to monitor our own sensors and the offsets. We need these environmental parameters as the temperature and the humidity, the RH and the pressure also. And every single electronical card has...
it's in there, but it's not mentioned in the presentation, yeah?
That's a default. Okay, I'll add it, no problem.
Okay, now it's clear.
Sure.
So what is the fail-safe option in your sensor? Like your internet is down, there is no Wi-Fi connection. Is there offline recording sensoring as well?
We have offline, not offline. We have not connected storage, an emergency internal storage. And when we get back to the internet connection, everything is sent to the cloud. But if the sensor is offline, unfortunately, we lose the...
This is the thing, like if it's offline, then it means you are not monitoring and the sensor is not working.
Yes.
So there should be a fail-safe option also when it should work during offline section as well. Like when have a, because it's very much possible that we have downtimes, and during downtimes, where is the monitoring? There is no monitoring. Yeah.
Sorry, if I may answer this question.
Tu parles dans le micro directement.
So it will be recording. If you mean if it's offline,
it's not connected to the internet. It's not connected to the Wi-Fi, no cloud. So
yes, it will be recording and storing data on the internal memory until it gets back online, and that is 2 weeks of.
No, we can go up to that.
Yes. However, if it is not connected to the power, that's a different story.
Oh,
yes.
Fine. So my question was like, the sensor should be working in the condition if even the Wi-Fi is down, you know?
Of course,
it will
yes,
be
it
working
is.
and recording on the internal memory.
So it's also a feature which is not mentioned there. So
Thanks, your questions are very helpful.
I'm increasing your features. You know?
Next question then.
Okay, the other one is like, when we have HCHOs, like these are the gases which formed up with the new furnitures and household items and all that. If we're going to suggest a client who really spend a lot on the furniture and carpets and all that, look, the gases are HCHOs and you have to do something with your furniture and all that. So in this condition, what he going to come back and give you this, answer? Because yes, we can tackle the air side. We can tackle the air like CO2 and all that, but how are we going to tackle the HCHOs, which is from your furniture?
We are actually measuring VOCs, total VOCs, with the PID detection. The thing is, I'm totally convinced as a chemist that there is actually no microsensor able to measure HCHO directly. So what we are doing, we're measuring the periodicity and the detection through our PID solution. And we do some complementary with a simplest radiolo passive absorptions and a laboratory analysis specific to the HCHO to do the identification. And we use it as complementary solutions for a short period, 5 days maximum.
Because VOCs can be actually tackled, and it's come through, like it's what you call them volatile organic compounds, you know. But then the thing is, if I'm going to recommend my client replace this new furniture with the old one, because they are actually the one causing the air quality, you know. So how he will react? So
always the same way. What they provided actually in Europe is they're providing some letters to classify the new furniture with an A, B, C category. It's a new categorization, and it comes in slowly, but it's very efficient with all the tests done on labs with on this new furniture and the samples they have. What we are suggesting, as we are totally concerned with these kind of problems in the malls and the galleries, particularly in Paris, in such galleries that you well known as Galeries Lafayette or Le Bon Marché, they're changing their decoration for Christmas. They're using lots of stuff, lots of new furniture. It's each 40 hours, 24 hours that they are modifying every time. It never sleeps. They never sleeps there. So what we suggest is to amplify the ventilation, and and I will answer to that not as the Zac manager, but just the simple scientist. The compound has the pollutants in the air will have reactivity, and if you go back to your organic chemistry classes, the HCHO is the most labile aldehyde that you can have. So if you take it from a furniture, it will have the ability to be synthesized to a second or tertiary compound very easily if we have like some variation of the temperature or humidity or some UV catalyzation or presence of some radicals like ozone, CO2 or oxygen in the room. So it's very, very difficult to do a specific formaldehyde detection identification with microsensor technology yet. I hope it will be, but it's very, very, very complicated.
The last one for your scent detective sensors, like which you put into the ducts, supply air ducts, or if it's nearby to those certain lures, which is like we install for sand trap, you know, and usually in these areas we have plenty of sand trap lures, you know, and we're going to capture it because there are so many sandstorms in this area. So how this sensor will react into this situation, because immediately he will sense and say that, okay, this is a critical situation, you know, because the sand is completely full in the sensor on that time.
Sure.
Because it's just an event, but it will tell you that your ducting system is compromised. You know?
This is why the expertise and the services are following the connected solution by itself. When we install these kind of solutions, actually we're doing like an offset measurement with a quit corresponding to the standards. I can show you that on the slide. I kept it afterwards. Just here, we have to respect different levels depending on the duct networks we are in, if it's a supply or return or an extraction duct, depending on the building. And what we do is we do an intervention to do the offset at the installation. Then you have an autonomy of 3 years for this product before getting in maintenance on it. If we don't have like a cleaning maintenance on the ducts. If we have any alerts, what we have to go to do first is doing a diagnostic. So we will send some technicians to see what's inside. As it's directly installed on an indoor access, we will be able to remove it and to see what's happening actually in the door, in the duct.
So within one duct network, you're recommending multiple points to install these sensors?
Sure. One every around approximately 30 to 50 meters, but we will more focus on strategic points than the distance between the door accesses.
So, if I can add, this device at least will help the maintenance engineer to understand that there is an event. He will still have to go and check. With the system that we have with the access doors, it is very easy to go to that point because he knows exactly where the event is happening. He will go and he will see that it was a periodic event and not all the network of ducts is already completely dusty. So he still have to go, but this device will help him to get alerted. Otherwise, sometimes it might happen a sandstorm, as you know, in this region, and he will not be notified. He will probably go by experience, but he might not go. And again, this equipment, we think that it will help him to assess the area.
We are actually encouraging our customers to go back. We have lots of our customers in Europe that don't have these solutions on their duct yet. But what we are doing is we are actually operating the cleanliness maintenance. It may be like a yearly or every 2 years. It's by contract actually. But what is the future for us and also for our customers, when we get the alerts through the Zac desks, it will be totally justified. We have no, if it's necessary to make it like every 6 months, we will make it. If it's necessary to do it every 5 years, we will do it every 5 years. We don't need to make it like every single year if it's not necessary. It's just help us to be totally transparent with our customers, to justify, to be totally, it's all about transparency and get the visibility on the pollutions in the air, in several levels of a building.
So if it's not due in 12 months, then it could last 24 months, then you can save it.
Of course, totally. Do we have some live questions? Est-ce qu'on a des... Okay. Please, Ustaz Mohammed.
I had one concern and one is a question. As you mentioned, it was going to measure a mold or for as a pollutant. You don't have a direct device to measure a mold or monitoring the state.
Yes, for the molds you have to do some, yes.
So you have a data bank information and other experience, etc. Is your application smart enough to give me an alert that there is a potential of mold because temperature was like this, humidity was this, during this amount of month, blah, blah, blah.
Not only because of the temperature, and that's the...
Could be a dust, could be anything.
No, it's not only about dust, because molds are vital, and they are real natural pollutants.
Humidity could be high,
Sure.
above 60.
But what you don't know yet is that the molds are rejecting specific VOCs that we are able to identify and to put a relation between the mold and the VOC. So what we do is with our solution, we will be able to correlate temperature, air H, and VOC's detection. And if needed, we do some more development.
Yeah.
Yes. We sampling operation and also more identification analysis of the VOCs to be able to correlate everything and gives you all the answer you need. It's a complementary diagnostic. It's not only one shot or a periodic automatized solution.
The second question, when I look at these pictures that come to my mind, for the food industry in French itself.
It's another problem.
Yeah, I'm just asking for the pharmaceutical, we know that they should have a special zero, pollutant, etc., etc. Very sensitive one tablet for this amount of money. For the food, sometimes the contamination is not that much, will be a holistic, it's important. But any standard needed in French for, say, production of the milk powder, for example, you have to have a room, things to be controlled at this level.
No,
Production of certain flour or something. Like
it is. It is very specific, but you have to take lots of parameters for that. And I can.
That's what I'm thinking that.
For the food, you're
For food.
yes, for food.
For pharmaceuticals, different issue.
For pharmaceuticals, you can applicate this actually.
I just was wondering
But-
if you have a list of the industries,
Sure.
what is the minimum requirement?
Of course, you have the list actually. It's the first, the example of buildings adapted to a level, but this is only for the dust.
I mean,
For the food,
in terms of activities, a kind of food, like if it was, let's say, corn
Oh, if it's more specific, okay.
What is that food authority in France requires so the company could have some of your devices to ensure their commitment or ensure their filtration system is fulfilling the requirement?
It will be specific thresholds applied, and for us, we have sanitary, les fiches INRS, les fiches d'INRS.
Specific certifications or standards that you have to follow. Actually,
Depending on the activity that you are doing, particularly in the...
Is that such an industry, what type of monitoring they need to come to the summary?
first,
Or your devices to ensure, or devices similar to you, to ensure a right monitoring of no pollutant to increase during certain stage of operation.
yes, there is a regulation.
Continuous operation.
There is a regulation definitely for the food industry, whether it is food and beverage areas, restaurants, or food industry itself, where they produce milk or meat or things like that. Specifically on the storage, there is a big regulation and very, very constraint for the food. Similar.
So those industries, they have a proper
Yes.
Yes,
filter and everything.
yes, yes,
to monitor.
yes.
we have specific articles in our, actually it concerns what we called in France le Code du Travail. Because the activity provides, it's totally concerned by these pollutions.
I mean, in terms of industry itself, it could be in terms of individuals occupying in that area.
Yes.
That's different.
We-
In terms
we
of
will-
industry,
We
Yes,
will
yes,
have,
I think
it
we...
would be maybe more sophisticated.
Sure.
itself, I don't know.
it's totally specific. We have several articles in France that are totally specific on the activity. If it's like a wood industry, or if it's a food industry, or if it's leather manufacturing, or if it's...
Okay, that's clear, but I mean the food itself.
Yes, yes. I think we
But
can...
to avoid cross-contamination.
We can-
That's it.
we can investigate more from our side because we have teams that work on the food in the food industry. We're not developing too much this service here in the region. However, in France, we work a lot in food industry where we clean, for example, the ventilators, the condensers. All these areas are very well regulated. We can go back to the regulation and find more about this specific and extract it and share it with you.
And even more of it for all the food industry, it will depend on the fat that they are using. We have lots of parameters to take care of.
Yeah.
Sure.
That's the last question. Do you have any studies mentioned or published on your website?
Yes,
That's me today because I'm going to check some information. Yes?
totally. And I will be able to send you all the information that you need. No problem.
Regarding implementing this system in somewhere, I mean.
Okay. Yes, totally. Ma'am.
Hi.
Hi.
Do you have any certain solution that is being deployed or has been deployed for ambulatory services? I mean ambulances, I mean aviation ambulatory protocol, transferring patients, critical care patients between hospitals or from one country to the other or from one territory to the other?
Interesting questions. For the power supply, it was a little bit difficult, but we had the requests. Particularly, we had the specific demand on our also buses in Paris, as we are concerning with very high period of pollutions, and they were totally changing all the buses in Paris downtown with hybrid buses. But the power supply was a little bit difficult for our equipment. Maybe the next generation would be easier to make it happen, but for the moment we only work with hospitals directly in the reanimation rooms and the blocks.
Yes. I think with the new product that Yasmin talked about, which is the Zac CR, Zac Clean Rooms, which is addressing mainly the critical areas such as operating rooms or isolation rooms, critical areas in hospital, clean rooms. This definitely, I think we have to work to combine it with ambulatory, to address and control immediately how the particles are evolving.
Yeah, and we need to know as well if it affects the aviation. We're talking about airplanes, we're talking about helicopters, we're talking about emergency life support ambulatory services. So does it affect those aviation?
If the activity affects the data, the measurement, or?
No, I mean the systems, your products.
No, because there is it's a common regulation considering the environmental parameters, and of course it will be like some correction of the offsets of the measurement, taking care of the temperature, the humidity, and the pressure. And when we are on aviation, on a helicopter, airplane, these parameters will change for sure. Depends. You know, in what is extraordinary in France, we are the first.
Some of the places, the technology might be different, but some of the places, typology, typical activities or way of activities are doing. Like in restaurant, you need to do this. Like, if there is any code or things that recommended, just the minimum things, parameters you need to focus.
The last period before COVID, and it's amplified just after COVID. It's actually they are encouraging all the public areas, restaurants, or every building receiving public to measure at least CO2, temperature, and humidity.
The generic one is I know.
This is the generic. Then we can add some more particulate matters, PM1, PM2.5, PM10, and VOCs. And then you can add, depending on your location and the external environment, you can add some other pollutant as ozone, NO2, carbon monoxide, or even maybe SO2, H2S, depending on what you have. For example, I will give you some examples of our customers. In the Caraïbes, in Martinique, we need to measure the H2S because they are totally contaminated with some algae coming, and they're having like some contamination periods during the year, and they have to move schools from the buildings to others because they cannot smell the sulfur odors that are very irritative. And it can take like 3 months, 3 months exposure. And what is complicated, it's not about the high concentration exposure. If it's a punctual one, it's a chronic exposure to low concentrations that might have more dangerous impacts on your health. That's the thing. And we have other examples if needed to talk about.
I will add, for specific activities, in France there is a book or a regulation called Code du Travail, which is
you have several articles.
It's the labor, how you say it?
I know the first part, code.
Yeah, Code du Travail. It actually define work code, workplace code. Yes. It define in very detail each area of each type of industry, what to do. Specifically, that in France, the law is strong with the employee. Very strong, probably.
So it's like occupational.
Yes, it's the strongest probably worldwide in France, and it's
we
well
are the
known.
first.
We live from that. So it's very detailed. I did the experience because for the health care areas, the work code in France probably is the toughest worldwide. There is a specific detailed for each parameter for air quality in each room, each type of room. So definitely, I'm not a specialist in the food area, but definitely there is a part that address each industry. To add,
that you have activities,
yeah,
it will find out that
yes,
belong to which food.
exactly. To add on this, by law, there was it was implemented a couple of years ago. Schools that have kids until 6 years old have to do monitoring system by law. So there is a law in place. In 2025, it will be all schools and public areas that are like malls, cinemas. By law, they have to monitor. And when I was preparing this event with Yasmin, because I live in Dubai, and sometimes we're not following up 100% on what's happening in France. The parliament members in France, and we're working on, she can explain it, are working on more constraint and publishing white papers specifically for indoor air quality. Definitely, the impact of COVID has changed
lots of thresholds.
Lots of standards and concepts in all industries. Maybe you can add.
Yeah, I think we have some live questions.
Yes, we have Virage. Can these be fitted on system already in operation now? And can they command fresh air damper to open and close according to air quality?
Yes, we can. Definitely connected to existing systems. It's all about API requests to get all the data on your own system, and specifically we can help directly by putting in contact our IT team with yours.
So we have a second question from Jean-Guy. For the smart building sectors, what IoT responds for IAQ to be correlated with the BMS solution completed, or even building operation system, which product, service, software?
Actually, all of them. All of them, because we are connected to clouds, to a specific cloud to get to store our data, and all of that is totally connectable to your system. Same answer that the previous. We just need to get in touch with the IT teams, and we will be able to manage what we can do. Did you have a question, sir? No? Yes.
Hey, hi. Hi, everyone. It's not a question, just I wanted to congratulate you. I was a client of IGIENAIR, and we worked together in a hospital here in Dubai, a major hospital provider in Dubai, and I just want to thank you for all the work that and all the support. And this was really appreciated, and the outcomes is just amazing. So thank you for that.
Thank you.
Thank you. Thank you for your trust. And thank you for your feedback and your thanks. So thank you, everyone. I will invite you to have a coffee break if you need. Yes?
Just one
sure.
thing. Thank you, Fatim, for your feedback. I would like to give a special thanks for the municipality with whom we are collaborating and working to enhance the indoor air quality, and we're trying to share our expertise and work with you hand in hand. Thanks for our partners, our client, Mr. Shamir. Thank you from the Ministry of Health also. If you don't mind, we would love to have a photo all together here, and then we go out for a coffee. Thank you very much.
And thank you also for our live customers. Slide numéro 1. Tu peux nous remettre la slide numéro 1, s'il te plaît?